Hi, everyone. Welcome back to another Facebook Live interview with the Spine Health Foundation. I'm your host, Erica Anderson, and I'm so excited to introduce our guest today. His name is Jed Finley. Thank you so much for joining us today, Jed.
Oh, Erica, it's so great to be here. I'm excited for this opportunity.
Yes, absolutely. Well, this month at the Spine Health Foundation, we are focusing on chronic pain. And our CEO, Dr. Rita Roy, she met you while you guys were both on another podcast.
Yes.
And you have a condition, and I swear I'm going to say it wrong, but I'm going to try it.
Okay.
Ankylosing spondylitis.
So close, yeah. Ankylosing spondylitis.
Oh, I knew it.
Yeah.
See, I started to ask you that before, and then we got cut off. So
right, yeah.
So I guess let's just start off by talking about, because our community is really a lot of people that suffer from back and neck pain, but a lot of, chronic pain overlaps with other conditions. So
Sure.
Start off by telling us, what is this condition?
Sure. I mean, ankylosing spondylitis is basically a form of chronic arthritis of the spine. The immune system decides that it wants to attack the healthy cartilage in the spine. And it also affects the SI joints, the shoulders, hips, knees, and toes. But what it does is the immune system attacks the healthy cartilage in the spine, and it breaks it down and replaces it with bone. So if ankylosing spondylitis is not treated, you can end up with a completely fused spine, just a straight rod of bone,
Wow.
Which they call the bamboo spine. Fortunately, there are lots of treatments. People long ago, even before they probably even knew what ankylosing spondylitis was, they were very stiff, and eventually the bones break and people get this, just completely hunched over position. So it's chronic. There is no cure for it, and it is very debilitating and painful.
So I guess I'm sure there's lots of treatments, but what are some of the most common treatments that people use?
Sure. So people, the most common treatment, the frontline fighter is we have biologics. You may see them as Humira, Enbrel, Cosentyx. Typically, they are advertised for psoriatic arthritis and rheumatoid arthritis or Crohn's disease, but it also is used on ankylosing spondylitis. So without getting too technical, basically, the biologics go in and they tell the immune system, hey, let's not do that, okay? Which makes us immunocompromised, which in the COVID era is a great thing to be. We have to be extra careful to not get sick, and because our ability to fight is less. And that's mainly it's due to our immune system being hijacked by this ankylosing spondylitis, by these whatever.
Yeah.
but also our treatment also kind of weakens the immune system. After that, we take NSAIDs like Advil and ibuprofen, and a lot of people use pain meds. It's such a different disease. I say that if you meet one person with ankylosing spondylitis, you met one person with ankylosing spondylitis, because we all have a different story. We all have different symptoms. Some people live perfectly good lives, but others, they have a lot of trouble getting through the day, and may file for disability or anything else that may help.
And so you actually run sort of like your own community, right? Like a support community.
Yes.
Tell us about that a little bit. What goes on in your community?
Sure. So in 2007, Facebook had just introduced their groups, and I was diagnosed with ankylosing spondylitis when I was 12, and I'd gone through pretty much my whole life, so I was probably 27 at the time, and had never met anyone with it. And I was like, am I the only person? So I said, this is a great opportunity. I'm going to create a community. I'm going to create a support group called Living with Ankylosing Spondylitis. And it's just as a place for people to come together, talk about symptoms, talk about treatments, talk about whatever, they may deal with. And now, 13 years later, 14 years later,
you started a Facebook group in 2007.
Uh-huh.
That's so crazy, because nobody was doing groups back then.
Right. And it was completely different back then. It was more of like an old fashioned message board, where you had like little rooms you could go into. Now, I mean, as we know, it's just this huge cluster of people just all coming together. My group now has 36,000 people,
Wow. How do
somewhere in
you how
there.
do you regulate a group like that?
So I get help. I for the longest time I did it by myself, and I would check every single post, because we had a lot of people who were making posts that definitely did not go along the lines of what the group was for, trying to
Yeah.
sell things, inappropriate posts. So I would go through every single day, all day almost, and just I don't like this, I don't like this. I'd approve all the members. Um, Basically answer some questions. Do you have AS, or do you know someone with AS? And then they get in. But I now have help. I hired 3 moderators to help me out, who are people in the AS community that I know and trust.
Hmm.
And so, we all work together, and we're always chatting on Facebook Messenger. Is this a good post? What would you do about this post? How do you think we should
Hmm.
handle this member? So it's a great community, and I'm so glad that it's still going and it's so popular. It's 36,000 people or whatever we're at right now. I may be making that up, but it's
Yeah.
definitely 30 something thousand
Well,
people.
you were definitely, I'm sure you were definitely the first group that
I
popped
think
up on
so.
this.
I
Yes.
think so. There is another group, but they don't regulate as well. So I think I have the best moderated.
That's important these days, man. It's important with the
Hmm.
groups. Well,
Sure.
tell us a little about your story. You mentioned that you were diagnosed at the age of 12. So,
Hmm.
just give us the backstory on you.
Sure. Yeah. So I grew up in New Jersey, and I was a very active kid. I played ice hockey. I played football. I attempted to play baseball, but that wasn't for me. But I was active. I was great. And then one day I would wake up in the morning, and my knees were cracking, and my back was cracking, and I was kind of hunched over and groaning. And I was 12 years old at the time, and 12-year-olds are not supposed to get out of bed creaking and cracking.
Mm-mm.
So my ankles are swollen. It was hard to walk. So we went to the doctor, and I don't remember the whole process, but I feel like it was like just like that. And he said, "Look, you're 12 years old. You should not have these symptoms. You most definitely have ankylosing spondylitis." So unfortunately, at the time, there really wasn't any treatments, at least for a 12-year-old. We had treatments like DMARDs, disease-modifying anti-rheumatic drugs, but that wasn't good for 12-year-olds.
Yeah.
Basically it was, sorry, have fun.
Is that
um,
like is that rare for someone that young to be diagnosed?
it is. Typically, you're looking at your late teens, late 20s is about where people start feeling symptoms. Unfortunately, it's so hard to get diagnosed, because not a lot of doctors understand what it is. A lot of doctors, there's some misinformation long, long ago that made it into the medical textbooks. Like, it is only white men who can get it. So if you didn't fit that profile, you must have fibromyalgia, or you must just be making it up.
Oh. Hmm.
So people have to fight for a very long time. I mean, I was lucky to get like a 1-day diagnosis, but some people wait, 3, 4, 5, 6, 7 years, if not longer, until they find a doctor, because it doesn't always show up. It's active and not active, and it's an up and down thing.
Hmm.
All they can do is take a blood test, look for a gene marker, which the HLA-B27 gene marker, that was the marker. If you have it, you must have AS. Only about 8% of people with that gene actually get AS.
Mm.
And you're also able to get it without it, because they're finding now there's tons of other genetic markers and other things that could trigger AS. So if they take an X-ray and you don't have fusion in your spine, you take an MRI, it doesn't show a whole lot of inflammation, they say, well, you can't have AS, but it's a progressive thing. It takes a long time. I know some children who have terrible symptoms. They're very stiff and very in pain. Whereas I'm in pain all the time. I can't bend to save my life, but my spine isn't fusing. I'm doing okay. I'm still able to work with accommodations, but yeah, it's hard for people to get diagnosed. So for a while, getting back to my story, I just forgot about it for the longest time. I kind of knew it was there. I was always stiff. I ran cross country in high school and college, and I was just always very stiff. The coach was like, "Loosen up! Why are you clumping around?" It's like, I can't. I don't have the motion. I'm doing the best that I can, which again, I would hurt. would hurt so much afterwards. But in a way, it was kind of nice, like, because this is a hurt that I did. It wasn't just my body hating me.
Right.
But it was probably I was 22. Right about the time that I was going to go off my parents' insurance, and they're like, "All right, let's just get everything out of the way." So went to this rheumatologist, and he was like, "You know what? I think you might have ankylosing spondylitis." And I said, "Oh yeah, I was diagnosed with that
Look,
10 years ago. I totally forgot about it." But still, at that time, it was, well, sucks to be you. I mean, there wasn't a lot of treatments for it. But yeah,
that's hard to. I mean, even just thinking about being told, well, there's not much we can do for you. I mean, it seems like that would be a really hopeless feeling.
I mean, it is. I mean, like I said, I was doing okay, so I wasn't like, oh, I need the treatments. I need the treatments. But late 20s, I think it was, at some point, my neck got so locked up that I could not turn my head to the left. And which made driving very dangerous. I couldn't check my blind spots at all. And I was just hurting so much. I couldn't do as much as I used to. So I called up every rheumatologist in the St. Louis area where I live now. And I called 13 of them. I got denied by all 13 until one called me back and said, "She finds you interesting. And she always takes the cases that she finds interesting. So she will take you." So through her, I got on Humira, I got on NSAIDs, I got on DMARDs, I got on all the treatments. And, now it's just trial and error. What works, what doesn't work.
Yeah. Does it change? Does something work for a while and then, oh, it's not working?
Yeah. Unfortunately, that happens to so many people where they find something that works. It's, again, when I started Humira, I could finally, people say it takes weeks, months to work. Almost instantaneously, I started being able to turn my head to the left again. And it still hurts when I do this, but I can still do it now. But yeah, sometimes it works great. And then suddenly, oh no, it doesn't work anymore. Or, like I had an appointment with a rheumatologist on Monday, and I was like, "Look, I'm okay. I feel the drugs are working. However, could I feel better? What could I do? Because I don't know, what if there is something with it, just this one pill, this one injection that could make me feel so much better, but you can't find out until you try."
Yeah, that's frustrating. That's really frustrating.
Right.
So, I think probably there are people that have sort of come to our community wondering, I don't know, what's going on with my spine. And maybe, they could have the same thing. So what are some of the most common symptoms that you see?
Sure. Lower back pain is probably the most common symptom. The SI joints in your hips get fused, which can affect the amount that you can bend over. I cannot bend over from my hips at all. If I'm standing straight, like I can go like this, like quite literally, I'm showing how much I can bend. So yeah, inability, range of motion decreased, lower back pain, buttocks pain, where the SI joint is. A lot of people will get inflammation of the eye called iritis or uveitis. I have met several patients lately who were diagnosed by an eye doctor.
Oh, weird. Yeah.
Yeah, because they saw the eye inflammation. They said that is such an ankylosing spondylitis symptom. So those are kind of the most common symptoms. I mean, other than pain.
Right. Yeah. And so if someone goes to their doctor and the doctor says, it's a mystery, I don't know, like, I mean, do you hear a lot of people that like have to go get second opinions?
Yes. A lot of people shop around. Unfortunately, there is, I feel, a shortage of good rheumatologists right now, or even rheumatologists right now. The one that I went to, who was great, but she was kind of part-time and she could only see me at certain hours. And it just wasn't working out. So, I started calling around, and it was hard. It was really, really hard to find a good rheumatologist. Finally, through my support group, through the Spondylitis Association of America that I run in St. Louis, they said, oh yeah, there's this partnership of doctors. They all work together. You see one of them, but you're kind of with the entire team. And after some begging and pleading, I finally got in to see one of their doctors.
Yeah.
But not everyone is that lucky. I know people who travel across states or to other states to get to a rheumatologist because they just aren't there. I asked my primary care physician, do you know any good rheumatologists? He said, honestly, no. I know a lot, but I wouldn't send them to you or send you to them because, they don't know what AS is. I find that a lot of people, it's a one-day class. Here's AS, it causes fusion. All right, now let's get back to talking about rheumatoid arthritis,
How common is it? How many people have it?
So most recent figures I've seen, there's 2.7 million people in the United States.
That's a lot.
Who have some form of spondylitis. It could be ankylosing spondylitis or the new term axial spondyloarthritis, because we needed to make something harder to say.
Totally.
So technically the new umbrella term is axial spondyloarthritis.
Okay.
And then you can be radiographic, meaning that you have fusion of the spine, or non-radiographic, meaning that you are not showing any, MRI or X-ray results. But
looks like we have a commenter.
Great.
I'm not sure if I'm saying this name right, but it looks like Karis says that the number was recently updated to 3.2 million.
Wow. Yes. Thank you, Karis. 3.2 million. Wow. That's great. Not great, but
great, for the research and all of that, it's great.
Because I don't take that as there's more people getting it. I feel it means there's more people getting diagnosed. Yes.
Right. That's such a good deciphering point because there probably are so many people that go years. I've heard this also, similar types of things in the MS community. They have the kind of thing where nobody can figure out what's going on and they end up going years without a diagnosis. So I wanted to ask you about this. So since I started with the Spine Health Foundation, and just being in the Instagram world with people in the healthcare world, I see those with chronic pain using the hashtag Spoonies. So I was going to ask about that because I don't know the origin story or what it means.
Sure. Maybe someone will post this in the comments. It was because I totally forgot the name. I used to be able to pull that out right now. But there was this girl who she wanted to describe to her friend why she cannot go out, why she does the certain things and then she is just done for the day. And she used the analogy of a big pile of spoons. And she said, all right, well, I just showered. That's worth 2 spoons. She started off with 8 spoons. I walked here. That's 1 spoon. I went grocery shopping. That's 3 spoons. And suddenly she was out of spoons. So we started calling ourselves based on that Spoonies. People who have chronic illness, who just don't have the energy to make it through an entire day, like an able-bodied person. It's a great hashtag that has pulled so many people together.
That's kind of surprising that a simple story like that was the birth of it. But someone put it, that same person put in the comments. I keep feeling I'm going to say your name wrong, but Karis or Caris.
Caris. Yeah.
I'm sorry if I'm saying it wrong. Okay. But thank you for sharing that the spoon theory, Christine Miserando. So
there you go. Thank you.
So that's good to know.
By the way, this shirt was made by Caris. So.
Oh, so you actually okay?
Yes, we. They are my Spoonie sibling.
Gotcha. Okay. Thank you. I was like, you're saying it like you know it. So, so what is a couple last questions. One, when you're living with chronic pain, sort of that's really hard day to day. So how do you get through the day? What keeps you staying positive and motivated?
So my spondylitis community, my Spoonie community is great. I know so many people through Twitter, through Instagram, through my Facebook group. where we're all in the same boat together. I am not alone in my pain. There are so many other people who understand it. So the being a patient leader like I am and an advocate, I love that. It gives me, I like to say, it gives me pride and purpose. I am not mad. I am not upset about my diagnosis because it allowed me to enter this community and, fill the role of an advocate and a leader like it has. So that gets me through. And then just a lot of sitting down and knowing my body. If I don't have the energy, if I don't have the spoons to do it, I say I can't do this.
Yeah.
It's just too hard, and people have to understand that. But yeah, I mean, really, my community, that's what keeps me positive. That I can represent people, that I can do all that I do and run the support groups and do Twitter chats and events like this.
Yeah.
Yeah. Mm-hmm.
Yeah, that community is so important in all the things that we deal with in life, whatever they are. What would you say to someone that maybe has been newly diagnosed? What would be your top tips or words of wisdom?
Who was just diagnosed? I first of all know that you're not alone. Like I said, there are communities out there. Whether you join my Facebook group, Living with Ankylosing Spondylitis, or you go on Twitter and take part in Dawn Gibson's Spoonie Chat, which is how I met so many people. There is a community. So first of all, join a community. Get to know people. Second, you are the boss of your condition. Okay. It is in your hands. And yes, doctors, they went to school for all these years, but they do not live with your condition. So my advice is that you need to take charge of your appointments. Be an active patient, write down your symptoms, write down how you're feeling, what medications you're on. Is it working? If it's not working, tell your doctor it's not working and get on something else. Don't be passive about it. And then just know what your body's telling you to do.
Mm-hmm.
It was so hard, getting accommodations at, I'm a special education teacher, and getting accommodations at my school. I was in an autism center, and I loved it. I wish I was still there, but it was so physically demanding that I just couldn't do it. And, I had to be transferred to another position, which is great. I love it. I get to teach. I don't have to lift kids and change diapers and, but that was hard for me,
Yeah.
Just making that step, getting an accessible parking pass. People look, I have never had anyone tell me that I shouldn't be parking there. They may be thinking that, but others, they do, and my doctor said, you're worthy of it. So I'm going to take that accommodation. It's hard. It is really hard accepting where you need help.
Yeah, that's such a great example on the parking spot thing.
Mm-hmm.
It's amazing how many people don't realize how many sort of unseen illnesses there are. And
right.
If I've ever been in the presence of someone that says something about it, I'm always like, hey, back up. There's a lot going on that you can't see just because someone's not in a wheelchair,
Exactly. Right. I know that the idea that you have to be in a wheelchair full time to be disabled, it's so not true.
So ridiculous. Yeah.
And, we're not, to the people who think we're not faking sick. We are faking well. We are trying to keep our heads up and keep a positive image. And because not a lot of people, they do not want to know about our pain. It is heavy stuff. We hide a lot of our symptoms just so we can get through the day. And, and I love, again, if anyone asks about, like I was wearing this shirt the other day at school, and usually people don't ask, but they were asking and I got to explain it. And I love doing that. I'm totally open. Since I got accommodations under the ADA, I have out. You know, I had to go to HR and sign a paper that said I have this chronic condition, and everyone knows about it now. And so it gave me freedom to not hide anymore, that I can talk about it. If you want to know about ankylosing spondylitis, I will tell you. You know, seriously, ask me. I love it. I had a kid in a fifth grader ask me, you know, it was so sweet. She goes, now, Mr. Jed, you don't have to answer this if you don't want to, but why do you park in the handicap spot? And I got to tell her, you know what? Well, thank you for asking. That's good. I have a chronic, you know, arthritis in my spine that makes walking difficult some days. Like, I'm doing well right now, but there's other days where I'm not doing well. So I love that she asked that.
Yeah, I think it's so great now because there is so much more information that is out there, and so great for people to be able to find those groups when they do get a diagnosis. Whereas like even 10 years ago, it was harder. It was harder to find your people.
Right.
And now it's so much better. And having that support, I think, can make all the difference. So, well, thank you, Jed, for sharing your story with us. It was really great to hear about it and just hear what people are dealing with. Thank you so much for all that you do. I'm sure that you really are sort of like a light and bringing people together in your community. So we appreciate your time.
Oh, thank you so much for having me. I really enjoyed this. And yeah, if learn about ankylosing spondylitis. If you don't know about it, look it up. You know,
We'll link your stuff.
Awesome. Great.